Good afternoon, ma'am.
Very good
Today I'm
afternoon.
with new questions, ma'am. Fibroids. Shall we start, ma'am?
Yes, of course.
Okay, actually, what is fibroids, ma'am?
Fibroids are benign tumors of the uterus. It is arising from the myometrium of the woman uterus. The incidence of fibroid, as one literature, it is 15% to 20% of all our gynae OPD are suffering from benign tumor of the uterus. And as per the post-mortem of all the patients who underwent hysterectomy, 50% they had fibroid. So it's one of the very commonest tumor, benign tumor of the uterus. Fibroid can cause infertility, can cause pain, dysmenorrhea, dyspareunia, it can cause repeated abortion, it can also become cancerous. It can become a sarcoma, 1% of the patient. It can get calcified during pregnancy. It can undergo red degeneration. It's very easy to diagnose because when a patient comes with complaining of the infertility or with complaint of the pain abdomen or with complaint of having pain during period, it is a must for us as a expert ART or gynecologist to do the scanning, TVS transvaginal scanning, and try to see these fibroids who are hyperechoic or hyperechoic of the wall-like structure where we see. And once we have a diagnosis, depends on whether patient symptomatic or not symptomatic, then we give them the treatment. Depends on whether she is suffering from infertility. If it is not occupying the endometrial cavity, then we can just manage. And fibroid always should be kept as a last resort for the workup and management of infertility because they have to rule out male factor, hormonal problem, age factor, AMH, tubal state, or PID. All those things must be ruled out, and still patient doesn't give any response to any treatment, then we have to offer her myomectomy, and that can be done by laparoscopic myoma resection, or if it is in the cavity and is a submucous, definitely it has to be removed. Basically, hysteroscopic myoma resection has to be done, and we have to give them time for healing the area for 6 months to 7-8 months, and after that she can go for pregnancy, which will be a successful pregnancy. In all the patients who are having a repeated abortion, repeated pregnancy loss, the submucous removal and the myomectomy, the hysteroscopic myoma resection is very, very useful modality of the treatment for all these patients. If for all the investigation are normal and this is fibroid is the only problem which they are facing, hysteroscopic myoma resection is the best. For other patients, depends on what problem they have. If she has got a pain and if she has completed her family, she can go for the hysterectomy. If she is still very desirous for having a family, then best way is to do myomectomy. Myomectomy can be done by doing a laparoscopic myomectomy, or it can be an open procedure. Most of our patients, they prefer laparoscopic myomectomy, which is very minimally invasive surgery when they stay in the hospital, and the healing and post-operative care is very good and fast, and requirement for painkiller or less. She can resume her duty very fast to her office, and that's all the treatment. Basically, if fibroid is asymptomatic and patient incidentally they are diagnosed to have a fibroid, so we don't do any operative procedure. We do basically follow up of the scan every 3 to 6 months. Or if patient in this period of 3 to 6 months fibroid become enlarged, then it has to be reviewed and planned for an operation or planned for a myomectomy. But if it doesn't have any enlargement in size or doesn't become painful, then it is better to do follow-up every 3 to 6 months. The other question which most of the patients they ask us, is there any role for medical therapy in fibroid? Yes, it is a small fibroid that we don't want this to become a big fibroid, or suppose she is not fit for the operation, or a young girl, teenage girl. So we give uripristal progesterone receptor modulator, which is 5 to 10 mg we give, but of late they have said that there are some side effects with the liver toxicity, that also we have to be cautious. But because fibroid is an estrogen dependent tumor, so it is always respond to the progesterone, like Deveri we give, medroxyprogesterone acetate we give, Mirena we give. These are the treatment modalities which we offer to the fibroid. Depends on what is their problem: pain, dysmenorrhea, infertility, or basically if it is rapidly enlarged and suspicious for cancer, then they have to go for an oncologist opinion.
Okay, ma'am. Ma'am, recent success cases of MHRI.
That just now you have seen.
Yes, ma'am. Thank you so much, ma'am.